Hi.
Hi, my name is Michaela. I'm going to be your nurse today. Before we start, I'm just going to wash my hands really quick for hand hygiene, okay? Okay, perfect. And before we start the whole assessment, can you just confirm your name and date of birth for me, please?
Yes, Daphne Tzadalichin, April 4, 75.
Perfect. And do you have any allergies?
No.
Good. I'm going to ask you a few questions and you're just going to follow along, okay?
Okay.
So do you know where you are today?
Kaiser.
Awesome. And do you know what day it is?
Wednesday.
And do you know what year it is?
2020.
Good. And do you know who our president is?
Trump.
Okay, good. The next question I'm going to ask you is about safety. So here at Kaiser Hospital, we care about your safety and wanted to know if you have had any thoughts about hurting yourself or others.
No.
Okay, good. Also, have you been feeling good today? What is your mood?
Good.
Yeah, is that normal for you?
Yes.
Good. And have you been feeling any pain at all on a scale of 0 to 10?
No.
Okay, perfect. Before I came in, the CNA did check your vital signs. Everything was within normal limits, and she also checked your eyesight, if you remember. That tested cranial nerve number 2, and you have 20/20 vision, okay?
Good.
Awesome. So now I'm going to check your head. Is that okay?
Yes.
Okay, so just upon inspection, I can tell that everything is symmetrical. Your eyes, your nose, your mouth, ears, everything. Is it okay if I start with your head?
Yes.
Can I touch your head?
Yes.
Perfect. So I'm checking for even hair distribution, no bruises, no bumps, no cuts. You have very beautiful hair.
Thank you.
And everything seems normal with your head. Did you feel any pain at all when I was touching your head?
No.
Perfect. Okay, now I can go to your ears, okay? Right now I'm going to use my flashlight. I'm going to check for any drainage or bleeding, no polyps. I don't see any of either of those, which is good. Now I'm going to check for your nose, okay? So can you look up? No deviated septum, mucous membranes are moist and pink, no polyps, bleeding, or abnormal drainage, which is great. Now I'm going to go to your mouth, okay? Just by looking at your lips, your mouth is moist and pink. There's no cracks or bleeding or anything like that. Can you open your mouth for me, please? Okay, no polyps, mucous membranes are pink and moist. No cuts or lesions. Can you stick out your tongue for me, please? Can you open your mouth and say ah?
Ah.
Good. So your uvula is in the middle and your soft palate raises when you say ah, which is good. Can you stick out your tongue and move it up and down for me, please? Good. Side to side. Perfect. That tested cranial nerves number 9, 10, and 12. Okay. Now I'm going to check for cranial nerves number 3, 4, and 6. I'm going to check your eyes, okay?
Okay.
So what I'm going to do first is I'm going to inspect your eyes. So before I even do the test, your eyes are symmetrical. There's no redness, no drainage, nothing like that. Have you been having problem with your eyesight recently?
No.
Perfect. So I'm going to use my flashlight. Is that okay with you?
Yes.
Okay, now I'm checking pupillary reflex, extraocular eye movements, okay?
Okay.
Perfect. Perfect. Okay, now I'm going to ask you to follow my pen light only with your eyes, okay? Not with your head.
Okay.
So 1, 2, 3. This is testing your 6 cardinal fields. Pupils are perla and your eyes have a little twinkle, which is perfect. Now I'm going to check for cranial nerves numbers 5 and 7. Okay, so can you raise your eyebrows for me, please? Perfect. And can you puff up your cheeks like this? Can you smile? Frown? Smile again? Perfect. That's what I like to see. Now I'm going to check your lymph nodes and for TMJ, okay?
Okay.
So this is the preauricular, posterior auricular, tonsillar, occipital, submandibular, and submental. Good. Your lymph nodes are non-palpable. Did you feel any pain when I was touching?
No.
Perfect. Now I'm going to check for TMJ, okay? I'm going to put my hands right here. Can you open your mouth, please?
Ah.
Close. Perfect. Did you feel any pain at all?
No.
Good. You didn't have any signs of TMJ, which is great. Now I'm going to check for hydration. Okay, so I'm just going to pinch right here for a little bit. Okay, no tenting at all, which is great. Now I'm going to check cranial nerve number 11. So I'm gonna push down on your shoulders and you're gonna push up for me, okay?
Okay.
So push up. Perfect. Now I'm gonna check cranial nerve number 8, which is the whisper test, okay? So just repeat what you hear when I whisper, okay?
Okay. Hello. Goodbye.
Perfect. Now I'm going to check cranial nerve number 1, which is your smell, okay? So you're gonna close your eyes and close one nostril on each side, and I'm gonna give you a smell and you're gonna tell me what it is, okay?
Okay.
So close your eyes, plug one nostril.
Peppermint.
Perfect.
Mask.
Perfect. Okay. That was all good. Now I'm going to check for your neck, okay? Can we move down to your neck?
Yes.
So now I'm going to start by checking your carotid arteries. I'm going to do one side at a time. And this is checking for bruit, okay?
Okay.
I check with the small side on the bruit.
Okay.
Perfect. You have no bruit, which is really good. Now I'm going to check for jugular vein distension, okay? With that, I just put the flashlight and see if there's any shadows, okay?
Okay.
Good. No jugular vein distension. That's great. Now I'm going to go down to your thoracic cavity, okay? With the thoracic cavity, I'm going to check your heart and your lungs, okay?
Okay.
So first I'm going to start with your heart. With your heart, we check with the diaphragm. Aortic, pulmonic, herbs, tricuspid, mitral. I'm going to check for 30 seconds. Okay, great. Everything looks good. You have no S3 or 4 sounds, all S1 and S2 sounds, which is good. That means you have no murmurs, no friction rubs, no nothing. So your heart sounds great, okay?
Good.
Awesome. So now I'm going to go down to your lungs, okay?
Okay.
So I'm going to ask you to take a deep breath for me, please, okay? I'm going to start with the front. So breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Perfect. Now I'm going to move to your back, okay? I'm going to check your lungs from the back. Just by looking before, I can see that your spine is centered and straight. There are no cuts, bruises, lesions, nothing like that. Just a tiny little sunburn, which is fine. So now I'm going to check with your lungs in the back, okay?
Okay.
So breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Perfect. Lungs are clear. There's no abnormal lung sounds, no friction rubs, nothing like that, okay? Perfect. So now I'm going to do your abdomen, okay? So if you can just lie down. Okay, is it okay if I lift up your shirt?
Yes.
Okay, so just by checking right now, there's no abnormal scarring, bruises, no distension, no ascites, no hernias, anything like that, okay?
Okay.
Have you been having any stomach problems lately?
No.
Okay, so now I'm going to check your abdominal sounds, okay? So, start with right lower, right upper, left upper, left lower. Okay, so you have normal vowel sounds, which is great. I'm just going to do a little bit of a light palpation, okay? Tell me if you feel any pain or tenderness. I'll stop right away, okay?
Okay.
Right lower, right upper, left upper, left lower. Did you feel any pain at all?
No.
Okay, good. There's no tenderness either. You can sit up now. Okay, I'm just going to ask you a little bit of an uncomfortable question. I hope it doesn't bother you, but can you explain to me when your last bowel movement was?
Today at 4 p.m.
Okay, can you describe the consistency and color?
It was solid and brown.
Perfect. And same thing, but with your urination? When was the last time?
Like an hour ago, and it was like light yellow.
Okay, and there was no like abnormal smell or anything like really bad like that? Okay, good. So now we're ready to move down to your legs, okay? Is that okay?
Yes.
Perfect. So actually, no, I'm going to do your arms first, okay? So now I'm just going to rub my hands all the way down your arms. Did you feel a sensation on both sides? Any pain at all?
No.
Okay, so your arms are warm to touch. Skin color is normal and pink, which is great. I'm going to check for your pulses over here. Okay, so I'm going to start with radial pulse. And then ulnar. Okay, great. You have 2+ bilateral pulses. Now I'm going to check for capillary refill. Capillary refill is less than 2 seconds, which is great. Now I'm going to check your upper cerebellum reflex. Okay, so you're going to move your hands like this as fast as you can. Good, you passed the test. Good job. Now I can move down to your legs, okay?
Okay.
Perfect. So I'm going to rub my hands down. Did you feel that on both sides?
Yes.
Perfect. Now I'm going to check for edema in your legs. There's no edema in your legs. And there's also no edema in your hands, by the way, okay?
Okay.
So first I'm going to check for the dorsalis pedis pulse right here. Good, 2+. Good, 2+ bilateral. Now I'm going to check for the posterior tibial pulse, which is right here. And popliteal, bend your knee. Good, other side. Posterior tibial, popliteal, bend your knee. Perfect. Okay, now I'm going to check some deep tendon reflexes in your legs. Okay, so I'm just going to do a slight tap with this hammer. It's fine. You can sit here. Can you uncross your legs for me, please? Perfect. You can just let your legs hang and relax. I'm going to check it, okay? Good. Perfect. Okay, your deep tendon reflexes are good. Now I'm going to check for your what's it called? Your gait. Okay, so you can stand up. You can start right here, and you can walk forward, heel to toe, just like this. Good. Now backwards. Good. You can have a seat again. Your gait is very steady. Everything is good. Now I'm just going to do the last few tests, okay? I'm going to do 2 deep tendon reflexes and a few other tests, okay?
Okay.
So first I'm going to start with your bicep reflex, okay? I'm going to put my thumb right here. Can you bend your hand? Okay, I just need a feel for this little tendon right here. I'm going to use my hammer, and I'm going to look for flexion right here, okay? Perfect. On the other side. Bend your elbow for a second. Bend. Good. Put it down. Perfect. Okay. Now I'm going to check for your brachioradialis reflex, okay? So, same concept. You can just lay your hand right here. Good. Other hand. You can just let it rest like this. Good. Okay. Now there's just a few more tests. So what I'm going to do is I'm going to have you close your eyes. Close your eyes. And I'm going to put an object in your hand. This is called the Topaxis test. Sorry, I can never pronounce it. Just tell me what you feel in your hand, okay? What are you holding? Perfect. Okay, now I'm going to do the graphesthesia test where I draw something in your hand and you're going to tell me what I drew, okay?
Okay.
So,
Heart.
perfect. And now I'm going to poke you somewhere, and this is called the Stier-Grannis test. I'm going to poke you and you're going to tell me if you feel sharp or dullness and also where it is on your body, okay? So
Left hand sharp.
perfect. Okay, so that concludes everything from our test. Do you have any questions today?
To open my eyes?
Yes. Sorry, I forgot to tell you to open your eyes.
No, I don't. You were very kind. Thank you so
Awesome.
much.
Thank you. You were very good and
Nice meeting you.
Nice meeting
Thank
you
you.
too.